Hey guys, Amanda here. So, I have some updates for you. I'm in a lot of pain. I'm not feeling very well, so please bear with me through this. I've been having trouble. I've had to write some notes down, excuse me, so I can remember what I need to say. Okay, so I went to my physical therapist today, and I think I said in the last video that she was going to call my neurosurgeon and try to get that order started for me for the injection. And when I went to see her today, I told her that yes, they had called me and I had spoken to the nurse to get the triage part done, and now it goes to the doctor, and then they call me back basically to schedule the appointment. And I have been, today was my 12th appointment of doing physical therapy, so I've gone 12 times, and I had signed up for 12 more. But what's going to happen is, because today I was there and I was doing exercises, and I was doing just a simple, easy exercise, and it caused pain in my lady area, and it was so painful it made me cry. So she wants to transfer me. I had said she was trying to get me into this place that was a little bit far away, but there's a place that's a little bit closer that has a zero gravity treadmill, and the therapist there, she knows and has the same training that she has in the area that she's trained in, with pain management and things like that. So she's going to transfer me there for the rest of the 12 appointments that I have approved for physical therapy. And in the meantime, because she was also helping me to get an x-ray, because I had fallen, and with my right hand I can only lift my hand up. See how it starts to shake? I can't get it to go up. That's not good. And I don't think I broke or fractured anything, but for her peace of mind, she wants to make sure that I didn't, because sometimes you can't feel that you have, especially if you have inflammation. And I can understand why she would want to do that. It's a good idea to do that. I only said that because I've fallen so many times, and I've had MRIs and x-rays, and every time it's like, oh yeah, you're fine. So it's almost like I fall and I'm in immense pain with a lot of inflammation, and they're like, yeah, we see nothing. There's like a slight, when I mean slight, they're like, unless you're a trained surgeon, you're not going to even know the type of slight. I'm like, okay. So I guess I just have a tough, frame, I guess. I don't know. So anyway, I have to go tomorrow morning to my doctor's office to see them to schedule an x-ray. I'm like, I just wanted, tomorrow I had nothing planned at all. I just wanted a day where I didn't have to get up and go anywhere, where I could just rest. But it is what it is. So I have to do that tomorrow morning. So that's what I'm doing. Okay, so I wanted to be clear. I said, hi, Shadow. See, my kitty's looking out for me. He says hello. He doesn't get on the camera that often, if at all. I don't think he's ever done that, ever. He doesn't like to be on camera. I'm always pointing it on him. So I am on, just to be clear, I said I was on steroids. I am on 10 milligrams of prednisone, and it's like a titration. So I was taking, like, I don't know, 5 for how many days, then 4, then 3, then 2, then 1. And I have 8 more days left of taking that. So there's that. Okay. So I was able to talk to my psychiatrist, and I asked if I could temporarily come off of the Lorazepam and go on Diazepam to help with, like, the muscle spasms and the pain that I'm having currently, because Lorazepam doesn't do anything like that for me. Lorazepam only helps with anxiety for me. That's all it's ever done. And Diazepam, doesn't do anything for anxiety. It helps with, like, muscle spasms and things like that. So she gave me 5 milligrams of Diazepam, but I take it like I would the Lorazepam. So 1 in the morning, 1 at night, and then 1 during the day if I need it, as needed for pain, and also for sleep too, because the pain that I'm having is making it hard for me to sleep at night. I'm sure you can see it all over me. I'm sure you can see the pain and the stress and everything. I can't hide it. It's there. So, I mean, my plan for this Diazepam is to be temporary until I can get the injection, until I can get things under control and get the pain and everything under control, through the physical therapy and hopefully through the injection, and, get to the place that I was at, where I was doing better. That is where I am right now for that. Excuse me. So, okay, so 2 other things. Topiramate, or Topamax. I started out on 25 milligrams, and it was increased to 50 milligrams because I was still having headaches or migraines, whatever. They are migraines. I mean, I have to close the curtains and everything, and it's light, sounds, sensitivities, all that. And also it was helping my mood a little bit when it went up to the 50 milligrams. But right now, I don't know if changing that from 50 to a higher dose would be the right thing to do at this time. I think I need to wait until I get things more under control, because I am getting headaches, but I think it's because I'm inflamed. I'm not feeling good, so it's hard to tell, so I don't want to mess around too much with the medication. But I did go from 25 milligrams to 50 milligrams of Topamax or Topiramate, whichever form you get it in. So the other thing is the Doxepin for depression. As I had said, I was and am still kind of I am still dealing with the side effects of, my uncle dying, and just the things that have come up in my thoughts and everything, and just bringing up the past and just all of that stuff. Yeah. See, it's affecting me. You can see it. See, just the thought of that, it's affecting me. So anyway, I was on 50 milligrams. Now I'm up to 75 milligrams. I think I started at 25 milligrams, went up to 50, then went up to 75 of the Doxepin. And it's to help with depression. Excuse me. And she said to be careful of watching out for, with the Doxepin, watching out for any manic symptoms. I don't believe I've had any manic symptoms from the Doxepin. Not to my knowledge, but, you know, I am taking prednisone, so that in and of itself affects your testosterone levels and can make you aggressive, you know, so it can mimic, maybe seeming like you might be a little manic or hypomanic. I don't know. I'm just saying. But anyway, this is what's going on with me. Excuse me. Right now. I'm sorry if you can't hear me. I'm sorry. There's so much freaking noise. Usually it doesn't bother me, but like everything just seems so amplified to me right now. Oh, another thing. I'm so, like, I can literally feel like this side of my body, I can literally feel a split in my body where I can feel this side is different compared to this side. Like, I can do all this side because I fell. Oh my God, it hurt, like, you know, in through this part of your arm, you know, up into the armpit area, down the arm. And I didn't realize, but she had me stretch my arm. She helped me stretch it, and then back here, because I guess I fell on this part of my shoulder again. It didn't hurt as much when I fell because I fell on grass. The last time I fell, it was on ice. And that really hurt, you know, and I went to physical therapy for that. And I'm doing like the exercises I've been doing the exercises for that. And, you know, I was getting to a good place. I was. But I look at this as a setback. I didn't fail. It's just a setback. And right now I have some hurdles. And I just got to navigate through these hurdles. And I will get to where I need to go. You know, it's like anything. Sometimes you stumble. But every time you fall, you have to get back up and keep going. You know, that is what I have learned. You know, you just gotta get up and keep going. You know, never stop, because you're not dead. You know, until you die, you keep going. You know, I mean, unless, you know, your body physically can't do it. You understand what I mean. So I hope I got everything that I needed to say out. Oh, yes. One more thing. I had made a quick short of a breast consultation, and I had received, like, they put it through, because what it is I have state insurance, and I was going out of state. Big old truck and a motorcycle at the same time. Really? So I have my state insurance. I'm going out of state, but they do accept my insurance in this out-of-state place for a breast reduction. And so I went there, I had the consultation, and everything looks good. I will talk more about that in another video, but I just wanted to say that it looks like it's gonna happen. So I'll leave it at that, and I will talk about that in another video. So just know that. And I don't know if I mentioned this, I do have an appointment scheduled in October for consultation for weight management. So, you know, I'm taking the steps, I'm doing everything that I'm supposed to be doing, and I'm overwhelmed. I am. I'm overwhelmed. My cat's out here going, Mama, it's okay, I'm here for you. Oh, and another thing, this might be TMI for the men, but I'm just saying this because this is part of what's going on, okay? I'm not trying to gross anyone out or be disgusting or anything. It's just part of life. It's part of what happens. So, as I said, I've had a lot of pain in the lower right abdominal area where it's just constant pain. It never stops. They think I have endometriosis. I have to lose a certain amount of weight to be able to have any kind of exploratory surgery, because that's the only thing that they can do, is do exploratory surgery to see if you have it. There are two types of techniques that they can use. So I've been told, to remove the endometriosis if they find scarring. That's if they find scarring. You can have it without scarring. That's so scary. And I have started to bleed, and I do not know if it's a period or if it is just intrauterine bleeding or whatever. I don't know which one it is. So I'm having that pain and that issue on top of everything else, and it's just a lot. It's a lot for me. I feel like I'm handling so much physically, and it's getting to me mentally. I'm not sleeping properly. Excuse me. It's just a lot. It's a lot. I felt like there was something else I wanted to tell you, and I feel like I just forgot. I don't remember. Oh well. That happens a lot. Like, I can't remember things. That's why I wrote all of this down. Like, that's why I was looking down. I'm like looking down, because I'm like, I gotta remember what I want to say. Okay, I told about that. I went through some medications I was on, talking about physical therapy. That's where I'm at. I'm not sleeping well. I don't know. I don't remember what it was. Oh well, if it comes to mind, then I'll tell you. Oh, I remember now. Okay, so on other platforms that I occasionally go on to, people have told me that they've been leaving me messages here on YouTube, but they haven't been seeing them. And I was like, really? So I've been trying to figure out why that is, like the comment section. And I've been trying to figure out what was going on. And for some reason, When I went into my comment section, it said that there were no comments at all. I'm like, oh, okay. And it said that for the longest time, and I didn't have any idea why it said that. Like, it wasn't even comments you haven't looked at. Like, I clicked on both tabs and no comments. There were no comments. And then a couple days ago, I just randomly checked it. And there were all these comments. Some were from like 9 years ago. What? So, I am sorry if I did not respond to your comments, because they are like from years ago. I am sorry. I am going to try to get to your comments. So if you're suddenly getting a comment and you're like, wow, I commented like years ago on that, that is why. I don't know what happened, but they're suddenly there now. So I'm responding to them when I have the chance. That was the other thing that I wanted to tell you. So to all of you who have left me comments and are wondering, why isn't she commenting back? You know, why isn't she talking back to me? That is why. I don't know what YouTube is doing. You know, I don't know. It's weird. I don't know. But since I have access to comments now, while I have access to it, who knows what will happen in the future, I am going to respond as much as I can when I can. So, yeah. Alrighty. I am going to go now because I would like to go and lay down and rest for the day. Because I still, you know what? I got one more thing to tell you. This is stressing me out. Okay. Twice now, I have ordered something online. One from Amazon, one from Walmart. Okay. Now, where I live, the same address is in a different town with the same name. It's almost the same name, but it has port on the end. You know how you have a town that has a port on the end, but then you have a town next to it that has the name but no port? That's what it is. That's how, you know, that's how it is. So the same address is the same, but if you don't type in the zip code, like if you are a delivery person and you do not type in the zip code, or you do not type in the proper town name, it will automatically route you to the wrong address. And twice that happened. Someone actually signed for it. It was a pill container that I needed for my son, and somebody actually signed for it. So somebody got a free pill container that cost me $23, almost $24. I also ordered something else from Amazon, and I got a refund on that. And I tried working with them, you know, doing it the nice way, whatever. They said, yep, give us 48 hours to have someone call you, blah, 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 try to get you a replacement, whatever. Nobody has called me. Nobody has contacted me. So after I'm done this, I'm going inside. I'm going to call them, and I'm just going to say, listen, nobody contacted me. It didn't happen. So let's just do what we originally agreed to. I would like a full refund and the 20% discount on my next order, if I order. So, yeah, there's that. That stressed me out. You know, it is what it is, but still. And they're like, well, there's nothing we can do. It's like, maybe you can take responsibility for your delivery drivers. If you're going to have drivers, then you should be responsible for their mess ups. Like, yeah, that's my thinking, but whatever. Okay, guys, I'm going to go now. I'm kind of like feeling, ugh. So I love you all. Thank you for listening to me. Thank you for bearing with me. Thank you for your love, your patience, your kindness, everything. And again, I'm sorry about the whole comments thing. I figured it out, sort of, I guess. Kind of just showed up. But anyway, I will get to your comments as soon as I can. And please don't, please leave comments. I encourage comments. That's how we keep the conversation going. I love you all. Please take care of yourselves. Spread the positivity as much and as often as you can. I love you all, and I will keep you updated and keep you posted on what's to come. And I will see you in my next video. Bye, guys. Peace and love.